Good evening, friends. At the outset, I thank organizers for giving me this opportunity. As you know, friend, the topic which has been allotted is one of the part of the duty of all treating physicians. Of the physicians used to go to pharmacists, and pharmacists used to prepare the mixtures and powders and used to dispense. In last century, things further changed, and we started writing directly to the patient and giving our prescriptions, as because the drugs are being formulated in form of injections, tablets and capsules and mixtures, and patients used to take. Let us see how this job is being performed. There is no conflict of interest, either personal or organizational, in my presentations. It is nothing against anybody, not favoring anyone. With this preamble, I would like to sensitize this issue through this Augustus gathering. The prescription writing is one of the ancient inherited document between physicians and patient. It can be considered as a significant communication of human race. It brings into focus the diagnostic acumen and therapeutic proficiency of a physician with instructions of the palliation and or restoration of the patient's health. The most carefully conceived prescription becomes useless, however, unless it communicates clearly with the pharmacist or adequately mistreat by the patient or how to take the prescribed medication. Proficiency at writing prescriptions accurately and speedily requires the practice. In the era of consumer protection, one more legal issue has been related to this prescription writing. So with these two important aims, one is to write the instructions of taking the medicine by the patient, and second, protecting ourselves from the legal issues which is being imposed to the medical profession. We used to write prescription and learn how to write the prescription. Friends, just this is an example that where we fail. The Genosin 200 milligram in a patient of PO for 7 days, Cifran 500 milligram, one tablet twice a day for 7 days, and A to Z and Losar 50, suppose he is having hypertensive. I do not know what sort of message these physicians want to give. He is failing in his aim to treat a person. There is a prescription which led to the highest amount of award by the Supreme Court against a medical doctor, a doctor of acclaimed, undisputed acclaimed academic status. When he wrote this prescription of dipamidrol 80 milligram IM, it is in public domain. For 3 days, intramuscular twice a day, 11 crore of the award has been instituted by the courts in India. This is the highest amount. You can very well understand the importance of writing a prescription and their legal implication over you. Here is again an example where our colleague failed. I am sure that if this prescription will be given to the colleague himself, perhaps he will not be able to find out that what he has written. So he completely failed to deliver the aim of the prescription writing. Some of the cross-sectional study I would like to present to you in a tertiary hospital of Maharashtra, Maharashtra, in rural Maharashtra, all prescriptions on hospital pad written, writers were not recognized. 17% were in illegible handwriting, 100% prescriptions failed to demonstrate address of the patient, a legal requirement. The proper strength, quality and route of administration were found in 73%, 65% and 75% prescriptions respectively. Now let us see who is entitled to write the prescription. Only a registered medical practitioner who is registered under the respective state Indian Dental Veterinary Council is authorized to prescribe allopathic medicine. The MBBS degree is minimum qualification. The veterinary doctor should prescribe only medicines used for the veterinary patients. A nurse, pharmacist, persons with dubious medical degrees for better Ayurvedic, homeopathic, naturopathy or Unani or whatsoever are not supposed to write allopathic medicine. Certain drugs in allopathy are also being prescribed by trained specialists only, such as letrozole can be prescribed only by the oncologist. Friends, let us see what is the requirement in your prescription. There are two major requirements. One is legal requirement and second is ethical and moral requirement. Let us see what is legal requirement. Name of the doctors with full qualification and specialty. Full address with contact telephone numbers, consultation timing, registration number of council, date of prescription with full signature, illegible handwriting, even typed or computer generated. This requires your signature also. A computer generated prescription requires a signature. Patient's full name with address, contact number if available, and always stick to formulation of drugs for which you are trained. Otherwise, you may be in trouble of writing wrong prescriptions. These are all legal requirements of writing a prescription. There is no compromise in all these things. Whether you are following or not, you are entitled to go under a legal punishment if your prescription is devoid of all these things. Some moral and ethical issues are also coming with prescription. Like if you stamp with full name, it will be better for you. You avoid using letterheads with multiple names of doctors. Don't use pre-printed messages or advertisement of pharma industry or diagnostic centers on your medical slip. Take extra precaution while prescribing habit-forming scheduled drugs. Use to write name of the drug details while writing combined formula. It is really a very, very helpful thing for the patient as well as to your other colleagues also, because they may also write the same composition of drug knowingly or unknowingly, and patient will take more toxic dose of the drug. Make a habit to write in bold. It is now considered to be a legal implication also. Few months back, Supreme Court has given this order, and MCI has also accepted the guideline that prescription should be written, drugs should be written in the bold letters. Never write SOS against any drug. Always write whenever required. Write age and sex of the patient if possible. In order to build safer system, we must be able to learn from our previous errors, and detection is the first crucial step. Scientific societies and surveillance agencies, their views, original studies and case reports may warn us to be on alert and promote knowledge of risk and improve our performance. For this purpose, a lot of reports, alerts, because you see this is not being taught in any forum or in any curriculum. So it is always to learn by yourself. So in our hospitals also, we must try to assess our prescriptions. We must try to assess the prescriptions of our juniors and try to find out fault in them and try to correct always that how we can correct our prescription legally as well as morally as per the requirement of the law, so that we can have a good purposeful aim of our prescription writing. And for this, non-profit making organizations like Food Drug Administration, European Medicine Agency, United States Pharmacopoeia, they always also try to give the art of writing prescriptions time to time on various websites. You can go and learn yourself about writing a good prescription. Try to limit each prescription to one medication. Circle your name when using pre-printed prescription pad. Limit each prescription to one medication. That will give you always a safe handwriting. Circle your name when using prescription. Eliminate drug abbreviations. Try to write full name of the drug. Use metric measures for the dosage. Add the patient's age to the prescription or weight of the patient so that if you just cultivate this habit, then dosage will be always as per requirement. Avoid writing as directed. Eliminate abbreviation in routes of administration. Specify the therapeutic duration. How long your prescription is valid. Always try to write that it is valid for 5 days, 10 days or 1 month or 2 months. Never give a never-ending prescription. Your contract should be always for a limited period with the patient. Prescribe specific quantities rather than dispensing for the time period. Remain cognizant of lethal dosage of the medication so that you can have a safe writing in your prescription. Try to specify the indication. Write additional instructions about side effects if possible. Try to report all errors to the pharmacovigilance. I will just give you 6 simple steps of writing good prescription. Define the patient's problem. Try to write down the history and try to come to a provisional diagnosis and possibly to a conclusive diagnosis. That will give always you an idea that what you want to write and which medicine you should write. Specify your therapeutic objective. It will give you an idea in which you will never overstep writing more drugs. Choose your standard treatment and verify the suitability of your treatment. Always try to conclude that what you are writing is suitable for the patients or not. Then after doing this, you start the treatment. Try to give information about the side effects to the patient so that he can report you as early as possible and you can save patients from the side effects as well as you can alter your treatment. You will get a chance to alter the treatment in the earliest phase. Monitor about the side effects and always try to stop whenever it is needed. So friends, in conclusion, the process of prescription generation and dispensing is governed by a regulatory system, the purpose of which is to maximize the safety of the patient and most effective. The incorrect prescription and inadequate information given by prescriber or pharmacist and faulty use of medication by patient can lead to major or minor harm to him or her. Many retrospective studies have looked into this issue of poor control of safety in the prescribing system and found mostly minor problems. However, these errors are happening in both general as well as in hospital practice. Unfortunately, these errors affect the safety of the patients and quality of the health care. There should be a clarity and a reason to prescribe a drug that is beneficial to the patient. The complete detailed history of disease, near accurate diagnosis, and full understanding of all comorbid conditions should be looked into by the prescriber. The decision of selecting drugs should be influenced by effectivity, availability, safety, and affordability. Always try to adhere to recommended guidelines and most of the time stick with in the limitation of your knowledge, skill, and expertise. Balanced prescription is very hard to achieve. Careful attention to the knowledge, understanding to principle of clinical pharmacology, properties of individual medicine, pathophysiology of the diseases under treatment, associated comorbid conditions, individual need and preference of the patient can make a near perfect prescription. Thank you very much for patience hearing.